Official solutions. Official solutions are liquid preparations that contain one or more soluble chemical substance dissolved in liquid solvent. In fact, there is no general method for preparation of official solution. Each solution has its specific method for preparation. But for purpose of a study, we can classify method of preparation of official solution according to the procedure employed. First, we have simple solution method. Simple solution method involve weighing the active ingredient, which is in a solid state, then dissolve it in about third-quarter volume of the solvent. If there is any liquid substance present as active ingredient, then we should subtract the volume of this liquid material from the third-quarter volume of the solvent and dissolve the solid substance in this remaining amount of the solvent. After that, we add the liquid material. Then you should complete the volume with the solvent and transfer to a wide mouth bottle and label it. The second method for preparation is called chemical reaction method. For example, we have calcium hydroxide. Calcium hydroxide can be prepared by two methods, simple and chemical reaction method. In simple solution method, we can dissolve calcium hydroxide powder in water as a solvent, or by chemical reaction method by adding calcium oxide to water, and the reaction results in the formation of calcium hydroxide. Which method is preferred, simple solution or chemical reaction method, and why? In fact, simple solution method is preferred over chemical reaction method because it is easier, not last long time, and do not require complex equipment compared with chemical reaction method. When chemical reaction method is necessary? Chemical reaction method is necessary when it is the only method for preparation. For example, formalin, which is used in tissue preparation. Also, when the solute or the pure solute may not dissolve readily from the solid state. For example, aluminum acetate solution, which is used for the treatment of eczema. Also, when several products that results from this chemical reaction may be desirable constituent for preparation. For example, magnesium citrate solution, which is used as cathartic. Third method for preparation of the solution is by extraction. Extraction involves both maceration and percolation. It is the method used for separation of the active drug from the crude drug. For example, adrenaline chloride solution, which is used for dental treatment as a local anesthetic. The other method is simple solution with sterilization, like anticoagulant, irrigating and physiological solutions and parenteral solution, ophthalmic solutions prepared from sterile ophthalmic powders. Case of anticoagulant solution. For example, we have citrate phosphate dextrose, USP. This sterile solution consists of citric acid, sodium citrate, sodium biphosphate, and dextrose. The solvent is water for injection. Physiological and irrigating solution. For example, we have ringer solution that composed of sodium chloride, potassium chloride, and calcium chloride dissolved in purified water. Ophthalmic solution, which is the other type of sterile solution prepared by sterilization and simple method. Pharmaceutical preparations are applied topically to the eye to treat surface or intraocular condition, including bacterial, fungal, viral infection of the eye or eyelid, allergic or infectious conjunctivitis, or inflammation, elevated intraocular pressure, and glaucoma and dry eye. All these conditions are treated by ophthalmic solution. The normal volume of tear fluid in the cul-de-sac of the human eye is about 7 to 8 microliter. Topical applications are administered in small amounts, liquid dropwise, and ointments as a thin ribbon applied to the margin of the eyelid. Excessive liquids, both normally produced and externally delivered, rapidly drain from the eye. A single drop of an ophthalmic solution or suspension measures about 50 microliter. Based on that, each milliliter contains about 20 drops. So much of an administered drop may be lost. Because of the dynamics of the lacrimal system, the retention time of an ophthalmic solution on the eye surface is short, and the amount of drug absorbed is usually only a small fraction of the quantity administered. Decreased frequency of dosing, increased ocular retention time, and greater bioavailability are achieved by formulations that extend corneal contact time, such as gel system, liposomes, polymeric drug carriers, and ophthalmic suspension and ointments. This is the structure of liposome. Barriers for intraocular transport. There are several barriers for intraocular transport. For example, first we have tear. Second, we have the cornea. Third, we have conjunctiva. Fourth, sclera. Fifth, retina. And choroid membrane. Tear is the barrier of the drug passage to the eye, because the drug can, the tear can bind with protein that is present in the drug, or the tear can dilute the drug and facilitate its drainage. Second, we have the cornea. The cornea is also a barrier for passage of a drug throughout the layers of the eye, because cornea is composed of three main layers. The outer layer, which is lipophilic in nature and called the epithelial layer. The inner layer is endothelial layer, and the middle layer, which is the hydrophilic stromal layer. Also conjunctiva. Conjunctiva of the eye is a thin layer that lines the inside of the eyelids and maintains the tear film. It is rich with capillaries and lymphatic vessels. Therefore, the drug that administered to the conjunctival sac can be cleared rapidly. Sclera, which is called white of the eye. It has been shown that as the lipophilicity of the drug increases, the permeability across the cornea or the sclera will decrease. Retina, which is located at the back of the eye. Choroid membrane, which is rich with the blood vessel and its thickness decreases with increasing of the age.